right, good afternoon, Mr. T. My name is Pete. I am going to be the practitioner doing your assessment today. Before we begin, do you need to empty your bladder?
Nope, I'm good to go.
Okay. Comfortable, the chair's okay, you're able to sit there for a bit?
Mm-hmm.
All right, fantastic. So what we're going to be doing today is a head-to-toe assessment. I'm going to be going through each one of your systems, going to doing some listening, some feeling, some touching. If you have any questions, feel free to ask. And if you need me to explain anything, let me know. I will talk you through everything as I'm doing it.
Okay.
But again, if you have any questions, stop and let me know.
All right.
All right. So to get started, can you tell me your name and date of birth?
Mr. T, 12/31/91.
Perfect. And then where are we right now?
You're home for an assessment.
Perfect. Can you tell me the day of the week?
Sunday.
And the date?
January 26, 2020.
Excellent. And about what time of day is it?
It's about 3 o'clock in the afternoon.
All right. Perfect. How did you get here today?
I drove myself.
All right. If you hadn't been able to drive yourself, how would you have gotten here today?
Probably asked a friend or family member to drive me.
All right. Awesome. So to start out with, I can already tell that the patient's alert and oriented ×4. Speech is clear, expressing appropriate judgment, presented him with a problem to work through of how he would have gotten here, and he answered appropriately. No issues with mobility that I can see so far. We'll dig deeper into that when we do the musculoskeletal assessment. His appearance is normal, affect normal, no issues there. And as far as attire is normal. In a clinical setting, I would probably have the patient wear hospital gown or some sort of drape. For the sake of the volunteer, I prefer to keep his shirt and pants on, so I'll be talking through appropriate draping and attire when we get to certain areas, but attire is appropriate. So from here, I'm going to go into just an assessment of your vital signs, starting with your temperature.
Okay.
So I have a digital thermometer, and what I would like you to do is just hold that under your tongue.
Okay.
And when it beeps, you can hand it back to me. All right. And temperature is 97.4, which is normal. I'm going to check your respirations now, so just breathe normally. I'm going to time them and then give you the findings right after. So just breathe normal, starting now. And what I'm looking for here is rise and fall of the chest. So we took 4 breaths in 30 seconds, so that's about 8 breaths a minute, which is perfectly normal. I'm going to check your pulse now, so if you could just allow me radial pulse, and I'll check for about 15 seconds. So 15 seconds, about 21 beats, looking at 84 beats per minute. Now I'm going to check your blood pressure. I won't be listening to the stethoscope. I'll be doing just your systolic blood pressure by palpation. So I'm going to put this on your arm. Any idea what your blood pressure is normal?
No.
So tighten this up and just relax your arm. About 122 systolic blood pressure. All right, so from here, I'm going to go into an HENT assessment, which is basically head, ears, eyes, nose, and throat. So if you could angle a little bit towards me so the camera can pick up. And I'm just going to palpate around the skull. Let me know if you have any pressure, any pain anywhere. issues?
No.
So right off the bat, I can tell face is symmetrical. He's not experiencing any pain anywhere. Hair is normal. Eyes, ears all appear normal. No issues with skull. His eyes appear normal. The lids and the lashes are normal. Conjunctiva is clear. Sclera is clear. So no issues just on visual assessment. So from here, we'll move into a vision assessment. So I'll be using a Rosenbaum card if you want to turn more towards the camera so they can see.
Okay.
So this is a Rosenbaum card. I'm going to hold it about 12 to 14 inches from your face.
Okay.
If you could cover your left eye, I'm going to have you start by reading this line right here.
Okay.
And just read as far down as you can.
All right. 63925 428365 374258 937826 426739.
All right, so now cover your right eye and do the same. Again, 12 to 14 inches, and I'll have you start with this line here.
Okay. 428365 374258 937826 426739.
Excellent. So vision is at least 20/20 based on the vision exam. So that's excellent. So now we'll move into a more specific vision test, pupils, eyes, ears, and things like that. So the first thing that I notice is the pupil size and shape. Pupils are equal, they're round, they're about 6 millimeters. Room's a little bit dark, so that's perfectly normal. What I'm going to do is I'm going to have you look right here at my nose,
Okay.
and I'm going to shine a light in one eye at a time. Nose, right? Pupil contracts, right eye contracts. Now I shine the light in the left eye and look at the right, and it contracts. Shine the right eye in the right eye, light in the right eye, and stare at the left, contracts as well. So pupils are equal and reactive to light. They are also consensual in their reaction, so no issues so far. Now what I'd like for you to do is stare right here at the tip of my light here, and then stare at the wall behind me, and then back at the tip, and back at the wall. So the pupils dilate when they stare at the wall and constrict when they look at the tip, which is normal. That demonstrates accommodation. You would expect this finding. I'm going to switch out my eyes here. Get a proper setting here for light, and I'm going to do what's called the red reflex test. So I'm just going to look in each one of your eyes one at a time. All right, so stay right ahead, just look right at the eye, right at the light. Perfect. And perfect. So red reflex is positive in both the right and the left eye. Everything normal there. Now I'm going to go into a sinus exam. I'm just going to palpate around your face. I would alcohol the hands again, maybe don some more gloves. Let me know if you feel any pain or pressure when I palpate the maxillary area.
No.
And now the occipital.
No.
Perfect. Nose appears symmetrical, nostril symmetrical. I'll do a little sniff test. If you could cover your right nostril. All right, and breathe in through your nose. Perfect. And the other side. Any issues there?
No.
Fantastic. So no issues with sniff. And if you could just tilt your head back a bit. And all right, and forward, bring your head down. And no issues there. Nostrils appear patent, and no issues breathing through your nose at all. All right, perfect. So from here, I'm going to do an assessment of your ears. Okay. So grab another apparatus. Basically, when I'm assessing the ears, I want to make sure that I pull the pinna of the ear that I'm examining up and back, and I want to angle the speculum of my otoscope towards the nose so I can get a good vision, good sight of the ear canal. So I'll come to the right first. Sorry, the left, my right, your left. Pull the pinna up and back. And the canal appears clear. Doesn't appear red or inflamed or any issue there. A little bit of wax buildup, perfectly normal. The exterior of the ear appears normal. No issues with the skin. Any pain with the ear at all?
Nope.
When I pull it back or down?
Yeah.
Okay. Same on the right side. I want to pull the pinna up and back and angle the speculum towards the nose. And canal appears clear. Again, a little wax, which is normal, no redness, no issues. Again, any pain when I pull up?
Nope.
Down?
No.
Fantastic. Tympanic membrane all appear to be normal. Again, no issues with blockages or anything like that. The next thing that I want to do is what's called the whisper test.
Okay.
What I'm going to do here is have you take your left hand and cover your left ear.
Okay.
And then I'm going to whisper something and see if you can repeat it, okay?
Okay.
Banana.
Banana.
Awesome. Now, cover your right ear, please.
Apple.
Awesome. So, properly identifies both things that I said, banana, apple, no issues there. So, since I am still on the head area, what I'm going to do now is an assessment of the cranial nerves. So, I'm going to go through cranial nerves 1 through 12 systematically, and I think what I'll have you do is tilt a little bit this way just so that the camera can see.
Okay.
So the first thing that I'm going to do is the olfactory nerve, and this will measure your sense of smell.
All right.
Is your balance okay? Because I'm going to have you close your eyes.
Yep.
All right, so close your eyes for me.
Okay.
And what I'm going to do is present you with smell.
Okay. Do I need to cover a nostril a little?
Yes, yeah, exactly. I need you to actually open your eyes for 1 second.
Okay.
Because we need to use something different than what I had planned. All right, so what I want you to do is cover your right nostril.
Okay.
And close your eyes. All right. And what do you smell?
Like a baby wipe.
Yeah, perfect.
Okay.
All right. And now cover your left nostril.
That's definitely baby wipe.
All right. Outstanding. So no issues with smell. You can open your eyes.
Okay.
So olfactory nerves are in place. Normally I would use like an alcohol swab, but apparently I didn't bring my alcohol swabs, but that's all right. We may do. So now I'm going to test your optic nerves, which is cranial nerve 2. So this is going to be done with a test called confrontation.
Okay.
And how we're going to perform this test is you're going to cover your right eye.
Okay.
I'm going to cover my left. And you tell me how many fingers I'm holding up.
2. 3. 4.
Perfect. And what I should have done is instruct you to look right at my nose. You did it anyway, so that's not a big deal. But again, cover your left eye this time. This time, continue to look right at my nose.
Okay.
I'll cover my right eye.
2. 2. 3.
Fantastic. So optic nerve is in place. Cranial nerve 2 has no issues. I'll move on now to cranial nerves 3, 4, and 6. Those are the oculomotor, the trochlear, and the abducens. And the way that I do that is I'm going to use my handy light. I want you to stare right here at the point and not moving your head, only your eyes. I want you to follow the light, okay?
Okay.
And hold on. Keep looking. Excellent. So he was able to follow through all 6 planes of vision. There was no nystagmus or quivering of the eye. So no issues with oculomotor, cranial nerve 3. We'll move on to trochlear. If you could stare at the wall behind me.
Okay.
So this dilates the pupil, and then I'm going to shine light into the eye. and reactive, and reactive. And I already checked for, pupil, the pupils being consensual with reaction to light, so I don't need to do that again. Now what I'm going to do is move on to the cranial nerve number 5, which is the trigeminal nerve. So let me turn the light off. And then what I'd like for you to do is to close your eyes. I'm going to palpate the face.
Okay.
And I want you to clench your chin, your teeth. Move your head side to side. All right, up and down. Wonderful. Furrow your brow. All right, wonderful. Cranial nerve 5 appears to be intact. We'll move on to the facial nerve, which is cranial nerve number 7. How I will assess this is sort of extremes of expression. So close your eyes as tight as you can, open your eyes as wide as you can, smile as big as you can, and frown as big as you can, and then puff out your cheeks like a blowfish. All right, fantastic. So cranial nerve 7 is in place. Facial nerve appears to have no issues. Now we're going to move into cranial nerve 8. This is the vestibulocochlear nerve. This one's a little bit more unique. What I'm going to do is utilize my tuning fork here.
Okay.
And I'm going to ping the tuning fork, and then I'm going to hold it in 2 separate areas. And you tell me if you hear it better in area 1 or in area 2.
Okay.
All right. So first, I'll tell you what. Why don't you close your eyes?
Okay.
Right.
And 2.
All right. And the same for the other side.
And 2 again.
All right, fantastic. So that's appropriate. Patient identified better with air as a transducer versus as a process. One more, if you close your eyes. I'm going to ping the tuning fork again, and then I'm going to hold it in the middle of your forehead. Let me know if you hear it more in the right, the left, or if you hear in the middle, okay?
Okay.
So ping.
Right in the middle.
All right, fantastic. So it would appear that cranial nerve number 8 is perfectly intact. I'll move on to 9 and 10, the cranial nerves. Those would be the glossopharyngeal and the vagus nerve. I need my light again, and I will take a tongue depressor. And if you could open your mouth wide for me, say ah.
Ah.
Uvula contracts up, and then I'm going to test a gag reflex. Oh, all right. Gag reflex is intact. I'm also going to have you take a small glass of water, swallow.
Okay.
All right, no issue there. Excellent. So cranial nerves 9 and 10 appear to be intact. I'll now do an assessment of cranial nerve 11. This is your spinal accessory nerve. What I'm going to have you do is move your head from side to side.
Okay.
So side to side, left to right, up and down. You shrug shoulders. Do the same thing against pressure. So side to side, tilt, left, right, up, down. All right, wonderful. And then finally, we're going to do an assessment of cranial nerve number 12. This is the hypoglossal nerve. And for this one, I'm going to have you stick your tongue out and side to side, up and down. Perfect. So all the cranial nerves appear to be intact. I can now move back into my assessment of the HENT system. From here, I would move into an assessment of the mouth. I was able to do that when I assessed cranial nerves 9 and 10. I noticed that the oral mucosa was moist, pink, no issues, no breakdown or anything like that. The lips appear to be intact, no excessive dryness or issues like that. The teeth were also intact. The posterior pharynx was intact, tongue normal, soft and hard palates were both normal, and the gums were also normal with no issues. So from here, we'll move into an assessment of the thyroid. If you want to move sort of so you're facing off that way,
Okay.
first thing that I want to do is Adam's apple, trachea, no tracheal deviation. I'm going to have you take this glass of water again, because I'm going to have you sip that.
Okay.
Again, head back, then, all right, so you can go ahead and take a sip of water. All right, so no issues with swallowing. Thank you very much. I'll take that from you. No issue with the thyroid test, no mass, no tenderness, no tracheal deviation, really no issues with the thyroid at all. If you want to tilt more towards me, so again, they can see you on the camera. I'm going to do an assessment of the lymph nodes now. Okay. So again, I'm going to have to palpate around your ears and face. Get some more alcohol in my hand, probably some gloves also. And I'm going to start by just doing a little palpation. Let me know if you have any tenderness.
No.
I'm also assessing for swelling, pre-auricular, post-auricular, occipital, the tonsillar, the submandibular, submental, posterior cervical. Also going through the deep cervical chains and the supraclavicular as well. Any tenderness?
No.
Any issues there? Excellent. I'm also going to go ahead at this point, since I'll be going into an assessment of the upper extremities while I'm on the lymph nodes, I'll have you put your arms out to your side if you can. That way I can also assess for the central, the lateral, also the pectoral, the subscapular, and the infraclavicular. Any tenderness, any issues?
No.
You can put your arms down for me. No swelling, no issues in the lymph nodes, no tenderness or anything like that, so the lymph nodes appear normal. Also assessing the upper extremities, the skin appears to be appropriate color for ethnicity, race. Skin temperature is warm. Doesn't appear to be issues with circulation. I'm going to palpate the radial and the brachial pulse on either side. Amplitude is good. +2 pulses on both brachial and radial. Doing the same on the left side. Again, the amplitude is good. Brachial and radial both a +2 pulse, so no issues there. So from here, one more thing I need to check is cap refill. So what I'll do is take either side and just press the nail bed, and the color returns in less than 2 seconds, which is what we want. So good circulation in the upper extremities, no issue there. So now I'm going to be doing an assessment of the posterior thorax. So if you have room, you can slide around to where your back is at the camera. So here, again, ideally, patient's back would be bare so I could do an assessment of the skin. I would want to see if there are any abnormal lesions, abnormal rashes, skin discoloration, mottled skin, anything like that. My assumption is that there would be no issues. Check the AP diameter, see that it's about 1 to 2, which is normal. Appears to be 1 to 2, so no issue there. Mr. T, if I could have you move a little bit to your right. Yeah, that's perfect. That way I'm not blocking the camera. Thank you. So what I'm going to have you do is just breathe in deeply and exhale. Breathe in deeply and exhale. All right. Appears to be symmetry. Breath is even. Going down the spinous process. Let me know if you have any tenderness.
No.
Spinous process appears normal. No issues. I'm going to be doing a percussion technique in 10 different areas, 5 on either side. Basically what I'm going to do is place my middle finger over intercostal spaces over the lungs, and then I'm going to tap on my own finger. I'm listening for tympani. I'm also assessing if there's any pain anywhere. If you could just bend over a little bit, kind of give yourself a hug. Perfect, so I can do a good assessment of the back. All right, so I want to find proper costal space, and then any issue?
No. 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 No.
All right. And then one final, the CVA, the costovertebral spot. I want to see if there's any tenderness. So I'll basically find costovertebral area. All right. A little percussion here. Any tenderness?
No.
Excellent. So now I'm just going to listen. You can relax.
Okay.
My stethoscope. All right. All right. Take a deep breath and release. Deep breath. 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 And release. All right. All fields are clear. Breath is normal, even, unlabored. Moving air in all lobes. At this point, if I were assessing a female patient, I would go into a breast exam. I would want to, you can turn around and face the camera if you don't mind. I would want to note the size and symmetry of the breast, if there are any abnormalities in terms of size, shape, any masses, anything like that. I would want to look at if there were any dimpling with the patient's arms at their side, arms on the hips, or arms out or extended overhead. I would also perhaps do an assessment where I position the patient with their arm under their scapula, so I could palpate for masses or any issues both on the left and on the right. I could have them lie side-lying with the head, with the arm under the head for palpation. I would also instruct the patient on how they could do a self-breast exam, about how often they would want to do it. They would want to do it at least monthly after a period. They could do it in the shower, in front of the mirror, again, lying, standing, much in the same way that I would perform the assessment myself in the office, arms at the side, hips up, overhead, and again with the arms beneath the scapula. Going back to Mr. T, I'd be moving into an assessment of the chest at this point. So again, patient would be without his shirt. I'd be assessing the skin, any abnormalities. I would be looking for bulges, for symmetry. I would be looking for a normal rate and rhythm of breathing. I would also want to listen to the front the same way that I did the back. So I'm going to go ahead and do that at this time. I think they can see you. So if you just take a big deep breath for me and release. Inhale 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 and release. And I'll just check the top. Inhale and release. Inhale and release. All right, so no issues there. From this point, I believe what I'm going to do is have you move over to the bed, and we will move on to the next portion of our assessment. Before I go on to there, when I was doing the cranial assessment, there was a brief section that I just remembered I left out. When going from the mouth to the neck, I would want to palpate the carotid pulse, and I'd want to do that bilaterally. Check for amplitude. I would expect it to be a +2. I would also want to listen with the bell of my stethoscope for carotid bruit. So with the bell. All right. So again, that would go with the neck assessment. Now, I believe we've completed the head to toe portion at this point, so now you can go on over to the bed and we'll move on to the second portion.
Okay.
All right. Outstanding. So, now that we're on to camera number 2, unfortunately, we weren't able to get an exam room for this physical assessment, so we're doing this in a bedroom. But in an ideal situation, the patient would be lying on an exam table or some sort of recliner chair that we'd be able to do this assessment on, but we'll make do with what we have. So what I'm going to have you do is lie slightly on your left. I'm going to place a pillow behind your back because we'll be going into the precordium assessment, the anterior chest assessment. Basically, with this assessment, can you get a little bit more on your left? I'm going to put this pillow. Right, that's perfect. So the best way to do this assessment is have the patient a little bit left side lying so that I can palpate and listen to all the areas appropriately. Basically what I want to do first is feel any pain or issues, let me know. I'm feeling basically at the left 5th intercostal space for the point of a maximal impulse. And I can palpate S1. It's perfectly normal. Amplitude is good, +2, no problem. I'm feeling for pulsations, for lifts, heaves, for thrills. I'm also, again, going back to attire, patient chest would be exposed, so I'd be doing a skin assessment as well with any issues there. You can lie flat on your back for this portion of it. Let me remove this. I'm going to listen to various areas of the heart. The first area is going to be the aortic area at the 2nd intercostal space on the right side. So I find midclavicular, move down to the 2nd intercostal space, and listen. Aortic area. Good. From then, I move to the pulmonic region, which is going to be left midclavicular, 2nd intercostal space. Then I move down to the Erb's point, which is at the 3rd intercostal space. I move on to the tricuspid area, which is the 4th intercostal space. Onto the mitral at the 5th intercostal space. And then at the 5th intercostal space is where I'm going to assess the apical pulse. And for the apical pulse, I'm going to listen for 1 full minute.
Okay.
So if you could just bear with me, 1 minute will start now. All right. So 83 beats per minute, which is just about right. I think I averaged about 84 beats per minute when I did the pulse check. So from here, we're going to move into the abdominal assessment. I'm going to have you flex your knees slightly. I'll place a pillow under for your comfort. How's that?
Good.
Excellent. So basically what I want to do is, again, skin assessment. Is the skin pale, mottled, red, any rashes, anything abnormal in terms of masses, discoloration, things like that? Make note of it. I don't anticipate that I would see anything, but again, I would drape the patient appropriately. I'm also going to listen to bowel sounds in all 4 quadrants. I'll listen to your femoral arteries, your kidney arteries, I'm also going to listen for the aorta. Basically, I'm going to use the bell of the stethoscope. If you have any pain anywhere, let me know. I'll pause and stop, okay?
Okay.
So first I'll listen with the diaphragm of the stethoscope for bowel sounds in all 4 quadrants. And it's normal, normal, again normal, and normal. If I didn't hear any bowel sounds, I'd want to listen to for a full minute to be sure that there were no bowel sounds. But I heard bowel sounds in all 4 quadrants, so no issues there. I'll now listen with the bell of the stethoscope, aorta. And I can hear the pulse just fine. Listen to the kidney arteries bilaterally. So I'm listening for the renal arteries. And then finally the femoral arteries. Again, it would be better if the patient was not wearing pants, but if you could just move the hand, I'll listen in the region of the femoral artery. Over the pants, I can't really hear anything, but I would listen bilaterally to the area of the femoral artery. At this point, I'm going to do a light palpation, so light feeling in the 4 quadrants of the abdomen. Let me know if you have any pain.
Nope. 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 No.
All right. Now I'm going to do a deep palpation where press a little bit firmer and then check for rebound tenderness where I will pull my hand away abruptly. If you have any tenderness, let me know, okay?
Okay.
And so the first right upper.
No. No. A little bit.
Okay. A little bit on rebound or on deep palpation?
On rebound.
Okay. So I'll make a note of that on my assessment.
No.
All right. So a little bit of rebound tenderness on the left lower quadrant. I'll make a note of that, put it in my note when I come back. I'm also going to do the same type of percussion, where in all 4 quadrants, basically listening for tympany. Place my ring finger over the area and percuss. Pain.
No. No. No.
All right, so no issues there. And then finally, with the abdominal assessment, I'm going to do an assessment for a hernia. So basically, I want to feel inguinal area. What I will do is instruct the patient to please lift your head off the bed and relax. No issues there. Any pain?
No.
All right, wonderful. So it didn't assess any hernia. At this point, I would go into an assessment of male genitalia. I would want to observe, palpate, visualize penis, scrotum, the distribution of hair, assess for any masses, any abnormalities with the skin. I would also want to palpate and inspect the testes, the epididymis, the vas deferens, again, looking for masses, any abnormalities with skin discoloration or abnormalities in hair distribution. And then finally, I would instruct the patient about self-exam. You want to do at least a monthly exam, do it in the shower, in front of a mirror. As part of the male genitalia exam, I'd also want to inspect the location of the meatus and if there's any discharge or anything like that. So from here, I'll move down to the foot of the bed.
Okay.
Now, normally I would stand at the foot of the bed to perform this portion of the assessment, but given the space we have, and I also want to remain in focus of the camera. Basically, I want to assess the lower extremities for any discoloration, which I don't observe. The skin is warm to the touch, appears to be good circulation. I am palpating the dorsalis medius, posttibial pulses, amplitude is +2. Cap refill, again, less than 2 seconds. And assessing the dorsalis pedis and posttibial pulses, both sides, posttibial and dorsalis pedis, amplitude is +2. Cap refill on the left is also less than 2 seconds. I don't notice any edema in the lower extremities or any varicosities. No issues so far. So at this point, we can move back to the chair and we'll switch back to camera 1 once we get over there. All right, perfect. If you want to have a seat on the bench. So, from this point in our assessment, we're going to basically be doing a musculoskeletal assessment as well as a cerebellar sensory examination. The first thing that I'm going to have you do actually is stand up, and if you walk off frame over here, basically what I'm going to do is I'm going to have you walk from one side of the room to the other and back again. I'm going to assess your gait, so you go ahead and just walk normally. So, doesn't appear to be any issue with mobility. Gait is even, normal, demonstrating heel-to-toe walking appropriately. If you want to come back and stand right in front of the bench. Arm sway is normal. This is kind of a confined space, but there doesn't seem to be any issue there. Next, we're going to do what's called the Romberg test. Right. Basically with that, put your hands across your chest like this, stare straight ahead. I'm assessing for balance. I want to make sure I maintain close proximity with the patient. No swaying that I can see. If you could close your eyes for me. Same thing, assessing balance, no issue. You can open up your eyes. You can let your arms relax. I'm going to have you stand on your left foot and hop up and down. All right, same with the right.
Okay.
Same with the, all right, perfect. All right, step back just a little bit. What I'm going to have you do now is some deep knee bends. So basically hands in front of you, get as deep as you can comfortably, and come straight back up. All right, awesome. Do one more for me just to make sure. Fantastic. All right, if you want to have a seat, we'll move into the next portion of our exam. So now we're going to do some more fine motor skill type assessment. I'm going to have you hold your hand up, pat your fingers rapidly, first finger to thumb, second, third, and back. Excellent. Hold your arms out for me. Touch your right first finger to your nose and out. Left to your nose and out. Perfect. Next thing I'm going to have you do, excuse me, is take your right heel and touch your left shin. Drag up and down. Patient demonstrated appropriately. Now your left heel to your right shin. Right, up and down. And again, demonstrated appropriately. I'm going to now, basically, I'm going to do a dull and sharp sensitivity test. Basically, close your eyes for me real quick, and I'll take your hand, hold your right hand up for me. So this is going to be sharp,
okay,
and this will be dull,
okay,
and I'm going to test in both hands, okay? So tell me if this is sharp or dull.
Sharp, sharp.
And the other side,
dull, and dull, sharp.
Excellent. You can open your eyes. Now I'm going to do a vibration test. What I'm going to do here is I'm going to ping the tuning fork. I'm going to hold it to one of your hands.
Okay.
You tell me, yes, I feel the vibration. And then I'm going to hold it there and tell me when you no longer feel it. Okay? So if you want to hold out your left hand for me and close your eyes.
Yes, I feel it.
All right. Let me know when it's no longer there.
I don't feel it anymore.
All right, fantastic. All right, now for your right hand, if you hold that out, keep your eyes closed. Ping, and feel it.
Feel it, yep.
Let me know when you don't feel it anymore.
And I don't feel it anymore.
All right, fantastic. You can open your eyes. So now I'm going to do two more tests. One is for stereognosis. The other is graphesthesia. Basically, with these tests, we'll do one first. We'll do the stereognosis one first. I'm going to have you close your eyes, and then I'm going to place an object in your hand, and you tell me what it is, okay?
Okay.
So if you hold out your right hand and close your eyes, and if you can tell me what that is.
The tuning fork.
Excellent. You can open up your eyes and hold out your right hand. Hold out your left hand, and keep your eyes closed, and tell me what that is.
The hammer that you used to hit someone's knee for the reflex.
Perfect. All right. Open up your eyes. Now for the other exam, the graphesthesia exam, I'm going to have you close your eyes again and hold out the palm of your hand. I'm going to draw a letter in your hand. Tell me what that letter is.
Okay.
And I'm going to orient myself so that the letters will be upright. All right?
All right.
So if you hold out your right hand, close your eyes, and tell me what this letter is.
W.
All right. And now with your left.
O or P.
Okay, perfect. Let me do one more on that side. Keep your eyes closed.
A P.
All right, very good. All right, so that takes care of that. From here, I'm going to go into an assessment of the upper extremities. First thing I'm going to do is have you hold out your right arm and just relax it. I'm going to assess for pulses. All right, pulses are normal. And then I'm going to do an assessment of the deep tendon reflexes, starting with the brachioradialis. What I'll have you do here is hold your wrist sort of limply. I'll strike you base of the thumb. And just let it relax, go limp. All right, I got a little bit of a reaction there. So positive response. I'm going to now do the biceps tendon. From here, I'm going to hold my middle finger over the tendon, and then I'll strike my finger, and I'll be looking for a response up in the biceps area. All right, and I got a positive response there. For the triceps tendon, I'll have you hold your arm out to the side, let it go limp, and I'll strike the elbow, and I got a positive response there. Same on the left side. Hold your left arm out. Let me first assess radial pulse. And amplitude +2. Amplitude is +2 on the right as well. Just let it go limp. All right, and I got a positive response there. Moving on to the biceps, relax your arm. Again, I'm going to strike my middle finger over the biceps tendon. See if I can visualize. All right, positive response here. And then hold your arm out to the side. Oh, I got a response there for the deep tendon reflex for the triceps. I'm going to do your lower extremities when I go into the lower extremity assessment. For right now, what I'm going to have you do is stand, and I'll have you face the far wall over there so that the camera can see you well. What I'm going to have you do is shrug your shoulders, hold your arms out in front of you, out to your side, back in front of you, over your head. What I'm going to have you do now is bend forward. You can let your arms relax. Bend forward, and I'm going to run my fingers down your spine. Let your arms dangle now.
Okay.
Assessing for any bulges, scoliosis, anything like that. No issues there. You can stand back up. I'm going to have you bend to your left and then to your right. Straight back up. One more time, I'm going to go down the spinous process. And again, no issues. If you could turn and face the camera, actually kind of face me a little bit so that the camera can see. I'm basically going to do range of motion at TMJ. So I'm going to palpate around the mandibular area. Open your mouth for me and close, kind of side to side with your chin. All right, clench your teeth. All right, fantastic. So no issues there. Basically normal function and range of motion of the jaw. If you want to have a seat, I'm going to do some assessment of strength for the upper extremities.
Okay.
So if you hold out your left hand, spread your fingers wide, clench your fists. All right. I want you to turn your wrist over, put your hand towards your face. Now push me away. Excellent. Same on the right side. Fan your fingers. Great. Clench your fists. Right, turn your hand over. Pull towards yourself, push away. Excellent. So no issues with range of motion in the upper extremities. I'll do the same thing for the lower extremities. Let me get in here and bring the camera down to where you can actually see what I'm doing. So if you could let your feet dangle. I'm going to do the same sensitivity tests that I did with the upper extremities. First thing I'll do is light and dull, like I did with the hands. So tell me if this is a sharp or a dull sensation that you feel. Okay. So if you close your eyes, and on the right side.
Sharp. Sharp.
All right.
Dull. Sharp.
Perfect. All right. keeping your eyes closed, I'm going to do the same tuning fork. Let me know if you feel the vibration on the right side.
Okay. I do.
Let me know when it goes away.
I don't feel it anymore.
All right. Same on the left side. Feel the vibration.
I do.
Let me know when it goes away.
I don't feel it anymore.
All right, fantastic. So now, if you could sort of move your feet, perfect range of motion. Great. All right, so press down like you're in a gas pedal. Bring your toes to your nose. Bring your heel into the chair and push away. All right. I'm going to assess the right patellar tendon, deep tendon reflex. So just relax your leg. All right, very good, deep tendon reflex. Same for the Achilles. There we go. All right, so we got that deep tendon reflex on that side. I did sensation on this side, so now I'm just going to do strength and mobility. Press down like on a gas pedal. Pull your toes to your nose. Pull your heel in and push away. All right. I'm going to do a reflex, patellar reflex, standing, and then for the Achilles. All right. Perfect exam there.